In this video, I'm going to show you how to relieve herniated disc pain in seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over easy exercises that can quickly relieve pains from a herniated disc. This includes lower back pain and sciatica. As a note, all of these exercises work just a little bit differently. They're also going to be shown in different positions. To get the best results, go through them all and use what gives you the most relief. As a bonus, all of the exercises can be done at home, require no equipment, and you may find give quick relief even within seconds. With that being said, let's get started and fix your herniated disc pain right now. If you're dealing with a lot of lower back pain or sciatica from a herniated disc, this is an exercise that I would start off with. It's really easy to do and you can do it seated. It's going to help improve mobility and also take pressure off lumbar spinal discs, so it just makes it easier for you to move around, hopefully with less pain. So let's start seated with our back flush up against the chair just like this. We want our back nice and upright, kind of in a neutral position. What you can do is take your hands and put them on your legs and kind of use them as supports to maintain that position. You want your knees roughly at about 90 degrees. I like to put my body weight also onto my heels during this exercise. It just offers a little bit more support. So the first thing that we're going to do is what is known as a pelvic rocker or a pelvic tilt. What I'm going to do is just simply slide and push my bottom into the chair as much as I can. As you do this, you're going to feel a very good activation of muscles around the hip, pelvis, and lower back. The key with this, do not go to the point of pain. If you start to feel that, back off slightly. You want to build up to that point, but not into it. Treat this like a marathon, not a sprint. So once you feel that very good activation of the muscles, what I like to do is hold this for about 3 to 5 seconds. And then from there, I'm just going to go in the opposite direction. So I'm going to slide my bottom forward. As I do this, try to tuck your tailbone upward like this towards your belly button. You're going to feel the muscles engage just a little bit differently. When you can't go any further, you're going to hold this position again for 3 to 5 seconds. And then from there, we're just going to keep repeating this over and over again for about 10 repetitions in both directions. If it feels like it's offering a lot of relief and you're still getting relief, you're more than welcome to throw in as many repetitions as you like. But it's just a nice, slow, controlled movement. To take this one to the next level, we're going to focus a little bit more on extension, which is going to take more pressure off a herniated disc, hopefully giving us more relief. So let's slide forward towards the end of the chair with this one. Try to maintain that good upright posture. For this one, I'm going to take my hands and I'm going to use my palms right here to support my lower back. Pretty much right near the belt line. I kind of just put my hands like this and cup over my glutes and press in there so it's nice and stable. This one pretty straightforward. As we press with our hands into our lower back and pelvis, you're just going to lean back with your upper back like this. The more that you lean back, the more that you're going to feel a deep stretch in the lower back. Again, do not go to the point that it is causing more pain or discomfort. Once you feel that very good stretch, you're going to hold this one for 20 to 30 seconds and do nice, slow, controlled breathing. Just let out as much tension as possible. From there, you're going to relax and then repeat this one 3 to 5 times. What you're going to notice with each repetition, you should have a little bit more range of motion to build into this. So always challenge yourself to stretch into it just a little bit more. To take this one to even the next level, you can now become more pinpoint with it. So instead of using your palms, take your thumbs right here and just place it right over the lower back, like right above the belt line, and press into the muscles right there and then lean back and see how that feels. Do this pretty much all over the lower back. So start here, go up a little bit, and just go over the whole area. You're probably going to notice that one certain spot is just your pinpoint spot, and this gives you the most relief. At that point, stop over that spot and throw in another 3 to 5 repetitions. One of the best and easiest ways to get instant herniated disc pain relief is with decompression traction. Think with a herniated disc, it's getting compressed and bulging out, nicking a nerve root, causing pain in the lower back and down the leg in the form of sciatica. So what we need to do instead is the opposite. Pull that joint open, bring that bulging material back in off that nerve root, get instant pain relief. Here's a really easy way to do this. For this method, we need something that is sturdy enough to support our body weight. So something like a countertop, a desk, or a table. And you want it roughly about hip level. What I'm going to do is just start off by putting my hands right here at the edge. Arms are going to be roughly shoulder width apart, and then put the front of your thighs flush up against the edge of that object. From here, we're going to go up on our toes, so all of our body weight is going to be supported on our toes. In this position, gravity is going to start to take your body weight down towards the floor, and you should feel a very gentle stretch in your lower back. It usually feels really, really good. Try to hold this one for 20 to 30 seconds, or as long as you feel that you can hold it. But if it feels good, you can definitely hold it for longer. When you need a breather, just come back up like this. But try to do this for 30 seconds for 3 to 5 repetitions. If you want to take this one to the next level, you can add a little bit of a rotation in with your pelvis. So go up like this and then just do kind of like a wiggling motion from side to side. It will just help take pressure off a little bit more and also aid in improving mobility. If you really want to take this one to the next level and get a deeper stretch, instead of supporting your toes like this, lift them up. It will greatly intensify this stretch, and the great part is you're going to get a very good arm workout at the same time. So one of the most common and debilitating symptoms of a herniated disc is sciatica. Here's a really easy sciatica exercise that you can do anytime that you start to feel it or it starts to build. This is called a McKinsey wall lean exercise. We just need a wall or a door. A note about this exercise, what we're going to be looking for is what is called centralization. So when a herniated disc puts pressure onto a nerve root, that is what causes sciatica to go down the leg. As that pressure is taken off, it tends to come back up towards the starting point, which is the lower back. So during this exercise, look for an upward trend of sciatica, not the other way around. If that's the case, back off. So for this one, what we're going to do to get into position is put the non-painful side, the good side, towards a door. Just remember, good door, good side towards the door. So in this case, I'm going to demonstrate what to do if you have left-sided sciatica. I'm going to put my feet together, have very good upright posture. From there, my feet are going to be roughly about a foot, foot and a half away from the door. And you're just going to lean into the door just like this. An important note, make sure that your wrist, elbow, shoulder are flush against it. We don't want any space from our shoulder to the door. Treat it kind of like a suction cup at that point. And then from there, you're just going to take your hand, put it on the other side's hip. Slowly press your hip towards the door. As you do this, you're going to feel a really good stretch form in the lower back and hopefully start to see that upward trend of sciatica pain. But again, with this one, do not go to the point of pain or discomfort. Back off slightly if you start to feel that. You're then going to hold this for 30 seconds, but if it feels good, you can hold it for a little bit longer. And do nice, slow, controlled breathing. Just let out as much tension as you can. From there, you're going to relax and then repeat this one 3 to 5 times. And with each repetition, try to build into it just a little bit more. To make this one more challenging and get a deeper stretch, just space your feet slightly away from the door and repeat. Here's an exercise that you can do in bed or on a floor. It's a 2-part exercise that's going to take pressure off a herniated disc, hopefully off a pinched nerve, but also it may help improve pain-free range of motion in our lower back. The first part of this is called a press-up, or if you're into yoga, a cobra pose. It's going to be an extension or backward movement that can help take pressure off that herniated disc. So let's start off lying on our stomach. We're going to take our hands, put them off to our side, roughly at shoulder level. Take your elbows, tuck them into your side during this exercise. The movement from here is very straightforward. We're going to press up with our arms, lifting our chest up and our shoulders towards the ceiling. Keep going up as far as you feel comfortable. As a note, you only want to move through your arms. Do not lift up on your hips or your pelvis. You want to keep them flat. But the more that you go up, the more that you're going to start to feel a really deep stretch in the back, but you should also feel it in the front over the core muscles and the front part of the leg. Do not go to the point that it causes more more pain or discomfort, especially sciatica. You want to stop right before that point and hold this comfortably for 20 to 30 seconds and do nice, slow, controlled breathing. Let out as much tension as you can. From there, you're going to relax and take a breather. On the next repetition, challenge yourself to build into it just a little bit more. What you're probably going to notice is you can go up just a little bit more because you have more pain-free range of motion. But do this one nice and slowly for about 3 to 5 repetitions. From here, what we're going to do is now build into the scorpion, which is going to help improve pain-free range of motion in our lower back. Again, we're going to be on our stomach for this one. I like to support my upper body weight on my forearms just like this. They're roughly in a V. I just put my hands together and I tuck my chin slightly towards my chest. I then bend my knees roughly at 90 degrees and put my legs and feet together. So for this one, what we're going to do is try to keep our stomach and upper back as flat as possible, and we're going to rotate through our waist and hips, lowering our feet downward towards one side as much as we can. You should feel a really deep stretch forming in your lower back. Again, with this one, only go to the point where it's a comfortable stretch, not to the point of pain. If that's the case, back off slightly. And you want to hold this one roughly for about 5 seconds. You're going to come back up like this, and then just repeat it on the other side. It's kind of like a windshield wiper. But just go nice and slowly from side to side for about 10 to 15 repetitions, and try to build into each one. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.